Sexually transmitted infections, STIs. Sexually transmitted infections, STIs, also known as sexually transmitted diseases, STDs, are infections that are primarily transmitted through sexual contact. STIs are caused by bacteria, viruses, and parasites that can be passed from one person to another during vaginal, anal, or oral sex, as well as during genital contact. Different types of STIs include chlamydia, a bacterial infection that can affect both men and women. Symptoms include abnormal discharge from the genitals, pain during sex, and pain or burning during urination. Gonorrhea, another bacterial infection that can cause similar symptoms to chlamydia, such as painful urination and abnormal discharge. It can also lead to infertility if left untreated. Syphilis, a bacterial infection that progresses in stages, with symptoms ranging from a painless sore, chancre, in the initial stage to skin rash, fever, and swollen lymph nodes in the later stages. Herpes, a viral infection that causes outbreaks of painful blisters on or around the genitals or mouth. The virus can be transmitted even when there are no visible symptoms. Human papillomavirus, HPV, a viral infection that can cause genital warts and is associated with various types of cancer, including cervical, anal, and throat cancer. Human immunodeficiency virus, HIV, a viral infection that attacks the immune system and can lead to acquired immunodeficiency syndrome, AIDS. Symptoms can include fever, fatigue, and swollen lymph nodes, but many people with HIV have no symptoms for years. Testing for STIs typically involves a physical exam and/or laboratory testing of bodily fluids such as blood, urine, or vaginal secretions. Examples of testing include Pap smear, a test used to detect abnormal cervical cells, which can be a sign of HPV or cervical cancer. Blood test, a test that can detect antibodies to certain STIs, such as HIV or syphilis. Urine test, a test that can detect the presence of chlamydia and gonorrhea in the urinary tract. Swab test, a test that involves taking a sample from the genital area, throat, or rectum to test for STIs such as herpes or gonorrhea. Treatment for STIs depends on the type of infection and can include antibiotics for bacterial infections, antiviral medication for viral infections, and in some cases, ongoing medication to manage chronic infections like HIV. Specific treatments for common sexually transmitted infections, STIs, chlamydia. Chlamydia is typically treated with a course of antibiotics, such as azithromycin or doxycycline. Sexual partners should also be treated to prevent reinfection. Gonorrhea. Gonorrhea is also treated with antibiotics, such as ceftriaxone or azithromycin. Sexual partners should be treated at the same time. Syphilis. The treatment for syphilis depends on the stage of the infection. In the early stages, syphilis can be treated with a single injection of penicillin. In later stages, multiple doses of penicillin may be needed. Herpes. There is no cure for herpes, but antiviral medications such as acyclovir, valacyclovir, and famciclovir can help to manage symptoms and reduce the frequency and severity of outbreaks. Human papillomavirus, HPV. There is no cure for HPV, but the infection can be managed with topical treatments or surgery to remove warts. The HPV vaccine can also help to prevent certain types of HPV that can cause cancer. Human immunodeficiency virus, HIV. HIV is typically treated with a combination of antiretroviral medications that can help to suppress the virus and prevent the progression of AIDS. This treatment is known as antiretroviral therapy, ART. It is important to seek treatment for STIs promptly to prevent long-term health problems and to avoid transmitting the infection to others. Practicing safe sex, such as using condoms and getting regular STI testing, can also help prevent the spread of STIs.